So now I am going to describe about the tibia. So you can see here the tibia actually is the preaxial bone, whereas in the upper limb radius is the preaxial bone and postaxial bone here is the fibula, and the upper limb it is the ulna. Because you know in the upper limb it is getting rotated laterally, that's why the tibia corresponding to the radius, whereas ulna corresponding with the fibula. Now if you see knee joint, the tibia is coming into the formation of the knee joint, whereas fibula doesn't come into the knee joint. Whereas in the lower part, tibia, fibula, both they are forming the ankle joint, articulating with the talus, where tibia and fibula they are forming the tibiofibular mortise. Now coming to the tibia, is a long bone, upper end, lower end, and shaft. In the upper end, we get two condyles, middle and the lateral condyle, and we get anteriorly the tibial tuberosity. This is the anterior border, this is the lateral border, and here is the medial border. We are getting medial surface, lateral surface, and here is the posterior surface. So in the lower end we can see the extra projection, so that is the medial malleolus. So once we tell about the side determination, the upper end, lower end, where the anteriorly the sharp anterior border, tibial tuberosity, and lower end this malleolus should be medially. So if I am thinking this is the left sided, so then you can see the tibial tuberosity, anterior sharp border, but malleolus is gone laterally. So this cannot be left sided, this has to be right sided, because out of these two, the tibia is the medial bone. Medial malleolus should be medially. So these are the 3 points by which you can find out whether it is left sided or right sided. Now I will discuss about the upper end. Upper end, this is the medial condyle, lateral condyle. These are the two condyles and intercondylar area. So these two condyles, there you will get the concave depression, that is for the articulation with the medial and the lateral condyle of the femur. So there convex, this has to be concave, and in between, so there we will get the hyaline cartilage on the articular surface, and in between these two condyle we will get fibrocartilaginous meniscus, Christian separate meniscus. So this is the medial condyle, lateral condyle, and this area is called intercondylar area, where we will get the eminence here, intercondylar eminence. The structures here you will get from anterior to posterior. Before knowing this, we should know inside the knee joint we will get two cruciate ligaments. Once you have studied the femur, the intercondylar fossa posteriorly in between the two condyles is the right sided femur. So this is the lateral condyle, this is the medial condyle, this is lateral condyle, this is medial condyle, intercondylar area. So here one mnemonics is there, LAMP. So lateral condyle, from the lateral condyle, in the posterior part of the lateral condyle, we are getting the anterior cruciate ligament, which is coming like this way anteriorly. It's coming like anteriorly. Whereas LAMP, medial condyle, for anterior surface, getting the posteriorly, the posterior cruciate ligament. So if you see like this, whichever the cruciate ligament is attached on the tibial surface anteriorly, so name is anterior cruciate ligament, which is attached to the posteriorly, that is name is posterior cruciate ligament. So anterior cruciate ligament, posterior cruciate ligament. Now we'll see how the structures are there in intercondylar area. Anteriorly first, so here is the medial meniscus, this is the lateral meniscus, so anterior horn of the medial meniscus, then anterior cruciate ligament, then anterior horn of the lateral meniscus, then posterior horn of the lateral meniscus, then coming posterior horn of the medial meniscus, and last that is the posterior cruciate ligament. In this way, the structures are placed in this intercondylar line. Now if we see the medial condyle, so the medial surface we can see a groove. So that groove is for the attachment of semimembranosus, and we have seen how after attachment semimembranosus is coming here, getting attached and giving the fibrous expansion oblique popliteal ligament and the fibrous expansion covering the popliteus muscle. So this is the posterior surface of the tibia where the soleal line, and this place we are getting the attachment of popliteus muscle. So here the expansion of this semimembranosus which is covering this popliteus muscle. Now coming to the lateral condyle, where this anterior part, here we will get the attachment of iliotibial tract. So from here iliotibial tract is coming like this way and getting attached to this place. This is the most important part in the facial laterally, so which is helping us in standing straight. So that is the iliotibial tract is coming, and we can see, so here is the anterior part where the iliotibial tract is getting attached. So now coming to the posterior part here, so there will be a groove for the popliteus muscle. So we know, if you see this is the right sided femur tibia, I am rotating it. So this is the lateral supracondylar line, medial supracondylar line. We know this upper part we are getting the attachment of shorted of biceps, and we are coming down. This part we will get the plantaris. Then we will get the lateral head of the gastrocnemius. Up to this part, this all structures they are not coming into this knee joint capsule. But the popliteus, you can see this groove in the lateral condyle. So that is for the attachment to the popliteus, which is actually intracapsular. It is coming like this way and taking a turn and attaching here. So that's why we are getting a groove on this lateral condyle of the tibia, a groove for the tendon of the popliteus, which is getting attached in the posterior surface of the upper part of the tibia above the soleal line. This is the soleal line, okay, because the soleus muscle will be attached there coming down, you will see afterwards. So this is all about the upper part. Another thing is left, that is the medial surface. So medial surface in the upper part, if we see here, so this is the part where three muscles are getting attached. So one is coming sartorius, is the opposite hockey stick manner. The most anteriorly three muscles will be there: sartorius, gracilis, and semitendinosus. So sartorius is coming from this acromial spine just below. Sartorius, then gracilis from here, and then coming posteriorly to see semitendinosus. We know from where the semitendinosus, lower medial part of this upper quadrangular part of this distal tuberosity, the semitendinosus is coming, and it's coming like this way. Biceps is going on that side, semitendinosus is coming on this side and taking a turn on the posterior surface of the medial condyle of the femur and getting attached posterior to this gracilis. So if we see first sartorius, gracilis, and semitendinosus. These are the three muscles which are coming to the upper medial part of this tibia. So this is all about the upper part of the tibia. Now if you see this sharp anterior line, it is actually coming down and joining the anterior border of this medial malleolus. If you see the medial border, it is actually coming down and joining with the posterior border of medial malleolus. So this part is fully subcutaneous. You can see, feel many times injury happens during the football playing or bike injury. So that is a shin bone. So this is the medial surface, fully subcutaneous, and you will get, I will show you in the dissection how the great saphenous vein anterior to this medial malleolus coming up and taking a turn in the posterior to the medial condyle and then coming up. So this is all about the upper part of the tibia. Now we'll see the shaft. Shaft, already I told you, the anterior border, medial border, interossea border very sharp, and the medial border. So they are making the surface, medial surface, lateral surface, and the posterior surface. So here we should study both these bones together because they are working as a single unit. So if we study like this way, then it will be easy to understand the muscular attachment. If you see, this is the medial surface, subcutaneous. This is the lateral surface. This upper part of this lateral surface. So here we will get the interossea membrane in between this tibia and fibula. In the upper part of the lateral surface, we are getting the origin of tibialis anterior. You will see there below how this all structures in the anterior compartment, that is the tibialis anterior, and here the fibula. We will see afterwards the extensor digitorum and extensor hallucis and peroneus tarsi. Three muscles are there, but that will be discussed during the fibula. But in the anterior part, these are the four muscles that are coming down: tibialis anterior, extensor digitorum, then extensor hallucis, and here the lower part will get the peroneus tarsius. So these four muscles, they are coming down to the dorsal surface of the foot. So all these structures coming below that extensor retinaculum and coming to the dorsal surface of the foot. So what we see here, this lateral surface, the upper part, we are getting the origin of tibialis anterior. Now coming to the posterior surface, because there is nothing, no muscle in the medial surface, only this upper part, we are getting these three muscles from anterior to posterior, opposite hockey stick manner. That is the sartorius, then gracilis, then semitendinosus. Now we are coming to the posterior surface. The posterior surface, we are getting one line, that is the soleal line, soleus muscle. Actually, if you see here, posteriorly, you see the soleal line, it will come like this way. This whole attachment of the soleus muscle, once we study the fibula, then together, that's why always we should study both this bone together, so that you can understand all the muscles, how they are arising from both the muscles, even with the interosseous membrane. Together we should study. Here you can see this is a soleal line. It's coming to this medial border, almost upper 1/3, lower 2/3. So this part we are getting the popliteus muscle, and posteriorly is the origin of soleus. So now coming to the posterior surface, here we are getting a vertical line which is dividing this area to the lateral and the medial part of this posterior surface. So this posterior surface, just to see here first, this surface. So this is the interossea membrane. Just anterior to the interosseous membrane, we are getting tibialis anterior. Just posterior to the interosseous membrane, lateral to this vertical line, we are getting the tibialis posterior. So here we are getting tibialis anterior, here we are getting tibialis posterior, and here we are getting the flexor digitorum. Okay, flexor digitorum, that is for dorsiflexion of this digits. So flexor digitorum, we are getting this medial part of this vertical line in the posterior surface. The lateral part, we are getting tibialis posterior. Here is the interossea membrane and anterior interosseous membrane. Anteriorly, the lateral surface, we are getting the tibialis anterior. So tibialis anterior, tibialis posterior, and flexor digitorum. Now coming to the lower end. In the lower end, we can see anterior surface, medial surface, lateral surface, posterior surface and inferior surface. So in the anterior surface you will see several structures are there, no muscle attachment, nothing, but several structures are coming there for the dorsal part of the foot. Tibialis anterior, then extensor hallucis longus, neurovascular structures, extensor digitorum, peroneus tertius. Whereas for the medially we are getting this extended part, that is the medial malleolus, where the deltoid ligament is attached, and the laterally there is a depression for this attachment of fibula. So inferior tibiofibular joint, where we will get this anterior and posterior tibiofibular ligament, and where this fibula is getting attached. So there this triangular facet, where upper part we are getting the introsei tibiofibular ligament. So these are the ligaments we can discuss in the ankle joint. And posteriorly, most important thing, we will get a groove, which we have seen here, the posterior surface, which is again divided by the vertical line, laterally and medially, because it is rotating like this, this will be lateral, this will be medial, because it is right sided. So laterally we are getting the tibialis posterior, here we are getting the flexor digitorum longus. So this groove is for the tibialis posterior, and inferiorly this is the facet for the articulation of the head of the talus. Here articulating the medial part of the talus and the medial malleolus. Anteriorly we will see the great saphenous vein, and the tip of the medial malleolus for the deltoid ligament, and posteriorly we will get the groove for the tibialis posterior. One thing I forgot, that is below the laterals we will get the lateral condyle for the fibula head. So that is the head of the fibula. I will discuss separately the fibula. That is the facet which is forming the superior tibiofibular joint. So that facet is there in the lateral condyle, posteriorly posterior inferior part, facet for the head of the fibula. So regarding ossification, the primary center appears for the shaft at about 7th week of intrauterine life, whereas two secondary centers have appeared for the upper end and lower end. The secondary center for the upper end, which appears just after birth and ossifies by the age of 17 to 18 years, whereas the secondary center for the lower end appears by the age of 1 to 2 years and ossifies by the age of 15 to 16 years. So this is all about the tibia.